All right, now the situation in Italy is getting worse. Coronavirus so far has claimed at least about 4,000 lives and has infected more than 40,000 people. And this has overwhelmed the country's hospitals. Doctors and nurses are now struggling to cope with the high influx of patients who are pouring in every single day. Intensive care units are running at full capacity, but still they're not adequate. Patients rushing to the hospitals are now being placed on beds in waiting rooms by the overworked healthcare workers. Now, in the main hospital at Bergamo, the area hardest hit by the deadly virus, the situation is said to be very, very grave. Patients are lined up in a narrow ward in more numbers than what the wards can actually hold. Nearly about 50 to 60 patients are coming in every single day with serious conditions, describing their symptoms as those of a flu. But the doctors say that it is actually not flu. These are very severe cases of pneumonia.
No, it's totally another thing. I think it's most pneumonia than flu. Mm-hmm. Because most people get pneumonia. And as I said before, it's a very severe pneumonia. And so it's a massive strength for every health system, because we see every day 50 to 60 patients who come to our emergency department with pneumonia, and most of them are so severe they need very high FiO2 of oxygen. And so we have to reorganize our emergency room and our hospital in 3 levels of intensity, as you saw.
Now, Bergamo is the epicenter of the viral outbreak in Italy. In recent weeks, the Lombardy province has become the site of hundreds of coronavirus deaths. The cemetery is so overwhelmed by the number of the dead that military trucks transported nearly about 65 bodies to a neighboring region for cremation this week. Now, experienced medical professionals who are used to working under intense strain have never been this stressed out in their careers.
I never felt so stressed in my life. I'm an intensivist, and I'm quite used to, intense moment and choices, and people are critical and will die without any, treatment, and you make the difference. But when you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.